Thank you for viewing my poster. This clinical case is about a 44-year-old woman with no history of chronic diseases. In the interrogation, we found that she had a sexual partner who died 5 years prior to the patient admission due to complications associated with HIV. She came for a month of evolution with an insidious onset olecranon headache, an oppressive type that did not improve with analgesics. A week before the admission, she presented behavioral alterations, which was why she went to the hospital. Upon arrival, a diagnosis approach began to be performed. On a physical examination, we found psychomotor agitation and alteration in alertness without neurological targeting data. A normal fundus without any alteration in cranial nerves, no meningeal signs. Laboratory studies were performed. The hematic biometry, liver function test, and blood chemistry were normal. Lumbar puncture was performed with a cytochemical study of the cerebrospinal fluid. It was found normal. Nevertheless, we found reactive ELISA for HIV, Western blot positive, and a count of TCF4 cells that it was 12. PCR with more than 40,000 copies. We performed also an MRI that shows a multiple asymmetrical bilateral lesions which did not produce a mass effect and with the ends in a ring with contrast. In this case, the patient was previous history of sexual contact with a person with HIV, so we focus on a probably neuroinfection. Due to the characteristic of the lesions found in the MRI, it was considered a diagnosis of toxoplasmosis in addition to a differential diagnosis of primary cerebral lymphoma. Remembering that some of the difference between these two entities is complicated due to the similarity they present in the imaging study. However, in the primary cerebral lymphoma, the lesions are usually unilateral and not multiple. In addition, we performed a spectrometry and the finding was compatible with toxoplasmosis. And then treatment was started with clindamycin and trimethoprim with sulfamethoxazole. Despite the initiation of the treatment, the patient did not evolve as we expect, and finally she died. As conclusions, toxoplasmosis can present as the first manifestation of HIV in patients without treatment. The diagnosis is made according to the radiographic findings and making differential diagnosis with other occupying brain lesions and with the response to a first-line treatment, which in this case is pyrimethamine and sulfadesin.